So no matter what I am, I want to grow up and become the Raja of spine. I think that's a sentiment that echoes with all of us, and I think everyone here wants to be the Raja of spine, and you know what I'm talking about. So I'm going to try in the next 15 minutes give declutter a pathway that may help us be a 10% of a Raja. At a time there can only be one Raja in spine or in any field, but we can try to emulate as much as we can. And it's easy to say you just follow the guru, right? The guru gives you the way and you just follow the guru. But in reality, that's not the truth. And you want to emulate, you want to do everything that your mentor does. But there are so many obstacles that actually get in the way of you getting to your path. And to follow the guru, you have to follow the principles that the guru has. And I think the 4 dimensions to be a good spine surgeon, and we'll unlock the 5th dimension right at the end. The 4 dimensions, I think we all agree, would be to be an astute clinician, to be a skilled surgeon, to be an updated academician, and then to be an inspiring leader. So if any of us aspire to be anywhere near the Raja of the spine as we grow older, I think these are the 4 virtues we'll have to work towards. And let's try and break them down and see what the Raja did and how you can do that same thing at your level, right? So as far as acquiring clinical skills goes, it's not easy, right? It's not easy to acquire clinical skills because it's an experience-based art. The number of patients you see, that's what gives you that feedback, and you can't acquire a clinical skill overnight. You can't pass an MS exam and say, I've acquired my clinical skill. So if you, again, look at your mentor, what does the Raja do to acquire clinical skills? Well, he continued to study in a time when it was not necessary. He had a business to go back to, a family hospital to run. But he continued to go all over the world acquiring knowledge, which was not necessary. I think we all can swear and say that he would have been as successful if he still didn't go on chasing his clinical acumen and building up his clinical acumen. So he got the MCH ortho degree back in 1990 when it was not one of the common things done, and that's a picture of the young Raja. He traveled and invested time. I think that's a bottom line, that you need to take out time from your schedule, because every time you're updating your clinical acumen, you're actually missing out on business. Your business is to be in the clinic and seeing patients. But remember, this is the reverse investment. When you invest time traveling, seeing, attending here, I'm so happy so many of y'all are here and y'all are not doing your practice or knocking off a fracture spine, because this is going to lead to you getting better and bigger as we go forwards. Okay, he rubbed shoulders with the top clinicians. So merely being around, what Sir said right now, the physicality of meeting and being around people who are knowledgeable, who exude that kind of clinical composure, will make you a better clinician, and you're doing just that. And then he continues to learn, right? So there's no ceiling to it. Like Madam said, that we come here, we've learnt more than what we've taught. I have learnt more than what I taught in the last 4 hours. So you continue to learn and continue to look for places where you can get your knowledge bits. And for example, Raja conducts this meeting at the GOSC, right? The Ganga Orthopedics Spine course, which is the operative course, Ganga Operative Spine course. The first session is a clinical learning session. And that is probably the best session of the course, where all the faculty are sitting together and learning from each other's tips and tricks. Because surgery is an art, it's not a science. So all of us have different methods of doing the same thing. And it's not in the textbook, and it'll be no lecture. It'll happen when you start discussing how do you solve this problem, sir, and how do you solve this problem. And from the different corners of the world, you'll get more and more information. So the more you engage in this activity, the more enriched you're going to get. And that's one way to shorten your learning curve. Right? Otherwise, you're going to just have to live those 25 years as a doctor to become, an enriched clinician. Okay, now what can you do? Before that, what does Raja do even now? So he sees his patients himself. This I've got from reliable sources. One of them is a 6'4" Dr. Ajay Shetty, who confirms that every case that Raja operates is seen by Raja. And that's not true even for me. Even I sometimes operate a patient who I've never seen. Okay, what else does he do? He discusses difficult patients. And it's not uncommon for me to get a call from someone from the Ganga team that this is a pediatric deformity, what would you do? And I'm like, you're asking me, I've learned from you. But they're still asking, right? So there's no shame in asking, discussing, and getting someone else's that extra bit of information. It may mean nothing in the end, but there's a high chance what you get from that person is worth its weight in gold. And discussing difficult cases rather than going and doing cavalier. मेरे को सब आता है. Discuss, take opinions and be open to those opinions, and that's going to make you a better clinician. Right? What can you do? You're still just a 1 year, 2 years post MS person. How can you be an astute clinician? Right? So you start early. You remember you're in the trap that unless you're experienced, you're not good. But if you're not good, you can't be experienced. That's the trap that a young orthopedic surgeon or a young spine surgeon is caught in. So the steps that you can work is, the number one is to work. Like, keep work as your primary, objective. And you saw all the fun stuff that I do. I started doing that only after 40. From the age of 28 when I or 27 when I finished MS, 15 years I worked like 16 hours a day. And I'm sure Raja and Naresh and Leela and Thomas and everyone has done that. So there's no substitute to hard work. This can't be said in a more relevant place than here. The more you work, the more number of patients you see, free, whatever, opinions, on phone, on WhatsApp chats, the more you'll be enriched. So work. Keenly look over the shoulders of your boss. So you may be opinionated. You all, for example, may feel that no, 12 months AKT is not good enough. But at least hear my opinion. Because you may then start to understand why someone else thinks like that. Right? So everyone has a right to, having an opinion. But everyone should also listen to other people's opinion. When you keep looking over the shoulder of your boss, you'll start understanding the nuances as to why he conserved this disc and why he operated this disc, or why he proposed fusion for this stenosis and he decided to decompress this stenosis. It can't be explained in books. So hang with your boss hour after hour. It may be torture sitting in the clinic. Sometimes your boss will say, boss, now you go. But you say, I want to sit here till you're here. I want to see every patient that you see. And in my mind, make a plan and see if it matches with yours. And that's what really helps you building your own plans. Of course, diversify. Because sometimes we get stuck in a logistical trap that I have been taught by so-and-so. So this is my way of thinking. This is the Ganga hospital way, or this is the VR spine way. That's not true. There are many ways of skinning a cat. So the more you travel, so I must admit that I've learned as much from Dr. Rajasekaran as I've learned from my own boss, Dr. Bhojraj, my mentor, right? Because the more you travel, the more aspects of treatment you get. And for that, you need to have an open mind. So don't be closed-ended on what has been taught to you. And of course, stay curious. The meaning of stay curious is that supposing you say, look, this MDR-TB is not in my thing. I don't want to. But I want to be curious. Why not? Your brain is so big. You're only using so much of it. Why not go back and read about the treatment of MDR-TB and next time come here and give me the lecture of how that MDR-TB should be treated. So stay curious. Don't put anything outside your purview. Everything is in your purview. The more you want to do, the more you will be able to do. All right, so that's in your hand, and because there are no limits. It's not like my IQ ends here. I can only do a laminectomy. There's no limit, and you can just keep learning and get better and better. So the black box here states that you got to give this time, you got to be patient, you got to keep reading up, you got to keep discussing, you got to keep taking opinions, and most important, be compassionate. Because if you have compassion for your patient, because your patient is going to be your teacher, if you want the best result for your patient, you will do all those things. If you want to just get the bill out of that patient, you will not do any of this. So you'll have to make that differentiation in your head and ensure that if you deep down want the best treatment for your patient, you will need to do this to give the best available treatment. All right? So the Ganga Hospital philosophy, if you see, which is Dr. Rajasekaran's philosophy, is that the team that he built was, built by passion. The people who are in the team, and you see some of them here, think the same way, act the same way, behave the same way, do the same, their outcomes are the same, their thought process, is the same, and that's what binds us together. All right? So this is all that comes from a very, critical interview, which I'll share you the title of that, and all of you should go back and read that interview. I had the privilege of actually listening to that live at the Global Spine Congress, where the philosophy of how to build a team came up, and you will hear this again and again. The bottom line is that you work for outcome and not for income, because we as doctors are service providers. We are not professionals making money. A banker is or a lawyer is very different from a doctor. Okay, our primary job is to give service, and making money is a byproduct. If you give good service, you'll really make good money. It should not be the other way. Okay? The next part is being a skilled surgeon, and here there's a bit of a dichotomy because many of us are born skilled. We have that artistry in our hand, and I think I'm going to err on the fact that Dr. Rajasekaran is born skilled because he was a good surgeon right from the start. Having said that, he still put in effort, and if you see, all the advancements in surgical techniques have started from the Ganga Hospital, whether it is osteotomies for anaconda spines, which we had never heard of before, to endoscopy today, which we look, guys like me look down upon it, but he's still at the forefront of it. His team is doing endoscopy spine and doing anaconda spines. So upgrading your surgical skill is again a requirement, even though if you're a skilled surgeon to begin with. What if you're not a skilled surgeon to begin with? How do you work around this? And this is where I put in my passion. And I was not a skilled surgeon to begin with. I hope I am one now. But I decluttered that thought process in my head that if I want to be a skilled surgeon, what are the attributes? What are the minimum attributes that a skilled surgeon needs? And you would all agree that these are those attributes. And you would also agree that the most of them are physical attributes. They are not genetic attributes, they are physical attributes. You know, how steady your hand is, how dexterous your hands are, what stamina and resilience you have. And hence, I would say that physical fitness becomes a mandate for all of us. We are actually medical sportsmen. Surgeons are medical sportsmen. We are not physicians, we are not brain people, we are touch, feel, hand, sense people. And we need to be sure that we are on the top of the game of this modifiable factor. Even the most unfit person can put his head to it and become fit. It's a modifiable factor. If you're unfit, you're at fault. You can't blame your genes. Everything can be worked around. So all I can say is that you want to invest in fitness because everything that you need as a surgeon is what a sportsman needs in his practice, or an army man needs in his practice, a soldier, or a policeman needs in his practice. We are in the same category of physically endowed people who need to give physical attributes, and we can't have a second best option. We can't have we can't come out of a surgery saying that it didn't come out well, it was third best, I could have done 2 times better. Every patient is his one and final surgery. And so I would beseech you to invest in fitness. So all the stuff that I do is for my own kida. It makes me feel happy, it gives me a high, but also it keeps me fit to do the long scoliosis surgeries without, because the moment of panic happens 3 hours into the surgery. And if you have not practiced that resilience, when you're running a marathon, at the end of Leela will agree with me, at the end of 18K is when you start bonking. And that's when you need to bring your A game to finish the marathon. Otherwise, you're a non-finisher. Similarly, the epidural bleeding or the big injury will happen 3 hours into your surgery. And that's when you need to bring your A game. And that's when your endorphins need to come up to the party and they need to make you think correctly. Otherwise, you start, going all over the place and making wrong decisions. And that's the difference between a captain of the ship and a sailor. And you're going to be the captain of the ship when you're the lead surgeon. So invest in your fitness. Besides that, update your skills regularly, and cadaver courses are the cornerstone of updating your skills because that's where you can be closest to doing an experimental surgery. So don't miss any cadaver course available in your area. Whatever unless you mastered that technique, whatever the course, just go and keep doing stuff on cadavers before you start doing it on people. Visitations, because you'll see surgeons using different hand skill tricks. In different places, people use different tricks, and you can imbibe those. Again, they are not given in, in books. One thing that I believe firmly and I practice is I do one new surgery every year. Every year I do one surgery that I've not done in the last year. So it started with TLIF, it went to C1, C2, something that I was not taught as a part of my fellowship, something that is not in the part of our curriculum where I practice. So the last year I did a sacral chordoma. No, I think that was year before last. Then I started putting cervical pedicle screws. So every year there's something new that I would aspire to do, which I believe will be of use in my practice. I go seek out a person who can teach me, and I learn it and I try to do it in my practice. Try to do that because it will help you exceeding, because surgery is an ever-changing skill. And, it's you got to be curious always to know what's going on. I think endoscopy is on my list because the way Ajay has sold it to me, I think I must learn at least some bits of endoscopy. So maybe in the next year or so, I may want to do some endoscopic surgery. And one way to do it in a small city is to partner with surgeons who, for example, if you have a bad osteotomy to do, and don't give it up, you try to get a person who can do it and do it with him. You will learn the art of doing that surgery once you've assisted that surgery once or twice, and you have enough mentors here who are happy to come in and help you and give you a hand. All right? what is the next thing? Updated academician. You have to be an academic surgeon to be a Raja of Spine. You may be a great skilled surgeon, busiest, and think about it. You may know a few dozen such people who are the busiest surgeons, who are making the most money, but are nowhere in the academic field. Would you respect that person more, or would you respect another person who takes out a Sunday in his family time just to teach people who need to be taught? You would respect which person? So being up ahead in the academic circuit is one of the investments you do. And one of the key things that I say is that if you ran a business, you would spend 30% of your income in advertising. Think of this as your advertisement. Now that I've come here, that many more people have seen me, known me, and they will think well about me. It's a pure recognition that I've got. Ditto as advertising, right? So think about it. If you're very commercial, you're still taking out that 30% time in academics. What did the Raja do, right? In his academic frame of mind, there was learning. So you first learn yourself. There's research, and then you start teaching, and that gives you self-development, right? So you have to begin early. It has to be a frame of mind. The frame of mind should be that I want to be a good academician and then a busy surgeon, not the other way, okay? You want to get involved in smaller groups, so you may say that who's going to listen to me? Well, your colleagues sitting around you would want to listen to you. And you start at that level and start building yourself up rather than saying that no one in this circuit will listen to what I say if I come and stand here. So work within your limitations, but keep working up. Never say no, obviously. So if you see the list of academic titles that Dr. Rajasekaran has, you will realize the way to go. There's no need for any of this. There's no need. I mean, he has a hospital to run. But even then, to stay in front of the academic business, this is what you need to do. So from your end, join online courses. These are early starts. You can do this early in your life. Join webinars. You can do this at your time, at your discretion. You can keep watching this again and again. This has become so easy. Attend minimum 2 academic meetings a year. I'm going to say 1 a month. Spend time attending academic meetings because you will learn a lot. Read recent publications on clinically relevant topics that you treat. Plan visitations that comes up again and again. And become a part of your local academic body and attend their meetings so you can start at a lower level and then aspire to become ASSI, SRS, blah, blah, blah. Right? There's there's no ceiling to the top. As far as research goes, I think none of us, can argue that there's only one person who's the most cited researcher in the world who represents us. Okay, and if we want to emulate that, you want to just go and see what sort of research and awards the Raja has got. And it can be awe-inspiring, but remember, awesome and inspiring. It should inspire you also. You should get inspired to do this, and we'll try and declutter the way. What can you do? So start by maintaining records. If you want to aspire to become a 500 publication guy, start maintaining your own records. Every disc you do, every patient you see, it's not so hard, it's just time consuming. Start writing up chota case reports for the Indian Orthopedic Journal, for the Indian Spine Journal, etc. Then start collaborating with colleagues to increase your database and work on clinical case series. You can do clinical case series. I treated 30 discs with cervical radiculopathy conservatively. That's a clinical case series, low-end research, but it's still a research. So it gives you a frame of or a flavor of researching. And then, attend courses because it's not a part of our curriculum to learn the art of research and the art of publication. So you need to attend separate courses. They're available online, they're available offline, where you learn what is statistics, how you read a paper, how you write a paper, what's the writing language, which journals require what minimum. For example, the New England Journal of Surgery, you need to register your research before you start. Otherwise, no matter what your data is, they are not going to accept it. So that's a taught art. So look for courses that teach you about publication and scientific research and attend it. As far as teaching goes, I mean, we are rubbing shoulders with the greatest teacher of our generation. And what the Raja does is, even now when he started, okay, like you and me in 1994, he still engaged in journal clubs, seminars in a makeshift area. This is all coming out of his own words. This is interviews from Dr. Rajasekaran. And that now has moved on to their hospital becoming the largest providers of formal orthopedic and spine education, right? So that's the pathway to the top. So at the bottom, if you start working, you build up a good base for the top. And today, more than 282 doctors of our country and 212 overseas doctors have been through their fellowships. And this is again dated. I'm sure this today the data is even more. And you obviously know the credentials of the hospital that they work in. And this has all been brought up by that 1994 beginning, where they sowed the seeds of academic discussions and journal clubs. And that's what you can do. And I mean, there's no end to the amount of awards. This will be like a feature film if I keep running it. So I'm going to just move on. What can you do in terms of teaching? Who wants to listen to you? So start with a permanent assistant. So many of us are shy to have a fellow. You can start with having a less qualified person, an MBBS, homeopath, whatever. Because the minute you have a junior with you who's a permanent, he's going to keep picking your brain. And then you got to be answerable and you start raising the entire standard of the unit. The minute you get a spine fellow, post-MS guy, the responsibilities on you increase triplicate. It's like having a child. And you have to then up your game to be able to sustain that guy's thirst for information. He's the generation ahead of you, right? Start speaking in local bodies. It could start with your building or Rotary Club, and then moving on to your local spine or orthopedic club. Then start making local state level presentations. Don't be shy to submit papers which get rejected. One day they'll get accepted. And then finally start a fellowship program, because that's what will build your internal pressure to learn and to do research and to do good academics before you then form a teaching unit like the Raja has. And then finally you want to be an inspiring leader. To be an inspiring leader, you need to know what leadership is. It's easy. It's man management. So identify what your peer needs and give him that. That makes you the good leader, right? So you start with a solo practice, move that into a practice group, and then you can have an institutional practice and become a person who can lead the world like the Raja has today, right? So work hard. The Raja of spine has worked hard to set the example. He's shown the courage of his conviction. He's passionate about everything that he does. He networks at every level, and here networking is not in a bad way. When I was showing this lecture to some of my colleagues, they said, one thing you missed is that when he talks to me, I feel like he's apna. He's talking at my level, on a personal level. That networking, I go back with a very, very positive frame about the person. And that's a very, very, acquired skill which you have to put in time and effort to do. So if I meet someone, I need to talk to him at his level. It's humility, and it breaks the barriers, and it makes everyone at one level. And it's a great way for a leader to be. A leader has to be in the team, not on top of the team, right? So the best leaders that you have worked with you and not ahead of you, right? And then lead from the front, lead with example. So understand people's strengths and weaknesses around you. You can start with the maid at home. There has to be trust, there has to be support and backing, and you have to give them what they are looking for, and retain good talent at all cost. So there's no cost that can actually cover the cost of a good human talent, which is going to be your workforce. And leading from the front is the most important. This is the research. This is the paper that I'll encourage you to read. This is an interview of Dr. Rajasekaran. It's a 3 or 4 page interview. It's out there on the internet. So you all can all go through this, and everything is given there. It's almost like the Gita of creating an academic leader or a surgeon leader. All right. So in terms of leadership, develop a good team, and that's what's going to back you. And then with that you can develop an institute from a unit and become, like I said, the world leader. We are trying that at our level. We have formed We Are Spine, and I keep asking Raja and Ajay what next, and we are chipping away at the block. You can form that kind of a team also. Now all these 4 dimensions covered, finally what is the 5th dimension? Do you agree or no? Yes. Like, this is the bottom line. If you are humane, if you have integrity, if you have empathy, if you have humility, and if you have family values, you become a cut above the rest. And think about how many people can combine the first 4 with the 5th. That's a very, very deadly combination, right? So this will make what you are. I mean, I don't have to further talk about this, but the words are self-explanatory, that if you have this in you, everything else will follow, and you will become the next big person in your community. Okay? There is a family that supports you, and in the end, no one else supports you as much as your family. If you can involve your family in your successes, they can be there with you in your failures also. And that is something that that no other cultures in the world have, that we have, and we can fall back on that. So in the end, to be a good doctor, work for outcome, not for income. Think global, act local. It's your practice, it's your service, it's not your business. We are not businessmen here. We are not looking at every patient as a patient, but you're treating people, right? Engage in good work-life balance. Cultivate extracurricular habits so you still have the strength to do your curricular work. And stay curious, absorb goodness. With every person you meet every day, you'll find something that you don't have. Try to absorb that and hang on to that, because that's one more addition in your personality. And become a wholesome person rather than a good doctor. Work hard on building resilience and conquer the fifth dimension by dreaming big, finding a role model, allotting prime time to non-professional activities, something that doesn't give you income, whether it's academics or whether it's extracurricular activities, and be a mentor. That's the only way you will evolve and become a lambi race ka ghoda. Thank you.